While I was in Ghana, I worked at the Volta Regional Hospital, and I spent a lot of time with the doctors going on rounds and learning about a lot of different clinical conditions. But I also spent a lot of time with the nurses just being on the wards and spending time with patients and hearing their stories. And I feel like that really inspired me and helped me to realize that a huge motivation for me in going into medicine is the humanities side of it, and really emphasizing that you can better treat a patient and be a more effective, more compassionate physician by spending the time to get to know them and to listen to them. I participated in a number of different outreach projects where we would go out to rural communities and speak with them about health insurance and the importance of health insurance. And I became very aware of some of the cultural differences. They didn't really understand why you would pay for health care if you were healthy. And a huge part of global health, I feel, is educating people about preventative medicine. And it's not just internationally, but also here about the importance of preventative medicine and taking care of yourself. In working with various communities on different global health projects, I've realized how important it is to create self-sustaining projects where the community has an integral role in developing the project. You really have to emphasize that science doesn't necessarily contradict various cultural or religious beliefs, that they really can be used together to promote overall health and well-being. The most incredible part about my experience being in Ghana was the time I spent at this children's home where I just helped the kids in their daily activities and with their homework, and just being there to support them and help them thrive and be a mentor for them was so inspiring for me. And that's why I'm so passionate about going into healthcare. I feel like just the little differences you can make in people's lives, just listening to their stories and being committed to helping them medically and mentally, and it's incredibly stimulating, and I feel like I learn as much from them as they do from me. When I was in Haiti after the earthquake, I spent a lot of time at this school developing activities for the kids because school wasn't in session and their actual school building wasn't even there anymore. And these kids would show up in their best clothes, so excited and eager to interact with us and be there and serving as mentors for them and helping them to continue just being kids and being excited about learning was really wonderful for me. Growing up, my pediatrician was always a huge inspiration to me. She always knew what was going on with my family and what was going on with me, and she really was a mentor for me and continues to be a mentor throughout my pursuit of medicine. And I really feel like she showed me what it meant to be a good physician and what a huge role a physician can play in their patients' lives as far as someone to support them and someone to really promote their overall health beyond just the science of medicine. I would be thrilled to travel with Timmy Global Health. Each experience that I have helps shape my perspective on healthcare and contributes to my development as a physician. So I really appreciate this opportunity.